Curing addiction is a complicated process, and clearing the body from harmful substances is sometimes not enough. Depending on the level of addiction, duration of substance abuse, and the extent of neurochemical process disorder it caused in the brain, the patient might be in a dangerous state and relapse even after months of abstinence. These drug cravings can be very hard to deal with, and Ibogaine treatment has proven to be extremely helpful in overcoming them. This great medical achievement comes from natural substance extract of the Iboga root from Central Africa. It is very strong and powerful, but if it's not used by professionals, it can be equally dangerous. This is why it is crucial for this treatment to be done in strictly controlled hospital environment. Whilst the patient is undergoing Ibogaine treatment, vital signs need to be monitored constantly, and the adequate dose needs to be carefully calculated for each patient. Keeping all this in mind, Dr. Vorobyev Clinic has altered a very detailed Ibogaine treatment that consists of 6 phases and lasts for 5 days. The first and the most important phase of the treatment is diagnostics. This consists of examinations that help doctors access everything about patients' physical and mental condition through tests such as urine test, HIV and hepatitis test, general analysis of blood, etc., as well as psychological tests used to discover the level of dependence. Preparation for the session is the time when the doctor determines the exact dose of Ibogaine that is going to be suitable for the patient using a few different tests. During the next stage, mental map is made, revealing all the bad experiences patients suffered because of substance abuse, the pain it caused the loved ones, and many other details from the past is extremely important during this phase in order for the doctors to be able to influence the patient's subconscious during the session. Finally, patient is ready for Ibogaine therapy. During the session, patient is able to see the disease critically for the first time, finally truly understanding all the negative aspects of it. This can be a visual experience for some, whilst for others it is more of a thinking process. A person goes through many different stages, feels regret and remorse for the people they love and hurt. Fear of addiction and strength to overcome it are developed. Ibogaine therapy offers a complete mental reset, allowing a fresh start in life. During the procedure, we provide constant supervision by doctors, 24 hours a day. At the end of the session, the results are evaluated, and if physical and psychological conditions are stable, patient is ready to go home. In the last 2 days of therapy, patient is closely monitored by our team of experts who developed an individual action plan for the upcoming months consisting of advice to ensure successful rehabilitation. Outpatient treatment is the last stage that takes place during the next year. Patient remains in contact with doctors in order for the condition to be tracked and in need of assistance during difficult times. This way, abstinence is maintained and the person is able to carry on living a stable life. Important notice: we use only medical-grade, lab-tested Ibogaine HCl in strictly controlled hospital environment. Patients' vital signs are constantly monitored by our doctors throughout the treatment. Our experts will carefully calculate the right dose for each patient based on his medical history and general health condition to maximize the therapeutic effect and minimize any unpleasant side effect. Do not use Ibogaine without experienced medical staff present.